Hello, welcome to Jacinta Polley Healthcare Channel. Today we would be talking about causes, effect, and prevention of heart attack. What is a heart attack? A heart attack happens when something blocks the blood flow to your heart so it can't get the oxygen it needs. More than 1 million Americans have heart attacks each year. Heart attacks are also called myocardial infarctions (MI). Myo means muscle, cardial refers to the heart, and infarction means the death of tissue because of a lack of blood supply. This tissue death can cause lasting damage to your heart muscle. Symptoms of a heart attack include discomfort, pressure, heaviness, tightness, squeezing, or pain in your chest or arm or below your breastbone, discomfort that goes into your back, jaw, throat, or arm, fullness, indigestion, or a choking feeling. It may feel like heartburn, sweating, upset stomach, vomiting, or dizziness, severe weakness, anxiety, fatigue, or shortness of breath, fast or uneven heartbeat, chest pain or discomfort, nausea, sweating, lightheadedness or dizziness. Fatigue symptoms can be different from person to person or from one heart attack to another. Women are more likely to have symptoms like an upset stomach, shortness of breath, or back or jaw pain. There are many more symptoms that can occur during a heart attack, and symptoms can differ between men and women. With some heart attacks, you won't notice any symptoms, a silent myocardial infarction. This is more common in people who have diabetes. Heart attack causes. There are a few cardiac conditions that can cause heart attacks. One of the most common causes is plaque buildup in the arteries, atherosclerosis, that prevents blood from getting to the heart muscle. Heart attacks can also be caused by blood clots or a torn blood vessel. Less commonly, a heart attack is caused by a blood vessel spasm. Your heart muscle needs a constant supply of oxygen-rich blood. Your coronary arteries give your heart this critical blood supply. If you have coronary artery disease, those arteries become narrow, and blood can't flow as well as it should. When your blood supply is blocked, you have a heart attack. Fat, calcium, proteins, and inflammatory cells build up in your arteries to form plaques. These plaque deposits are hard on the outside and soft and mushy on the inside. When the plaque is hard, the outer shell cracks. This is called a rupture. Platelets, disc-shaped things in your blood that help it clot, come to the area, and blood clots form around the plaque. If a blood clot blocks your artery, your heart muscle becomes starved for oxygen. The muscle cells soon die, causing permanent damage. Rarely, a spasm in your coronary artery can also cause a heart attack. During this coronary spasm, your arteries restrict or spasm on and off, cutting off the blood supply to your heart muscle, ischemia. It can happen while you're at rest and even if you don't have serious coronary artery disease. Each coronary artery sends blood to a different part of your heart muscle. How much the muscle is damaged depends on the size of the area that the blocked artery supplies and the amount of time between the attack and treatment. Your heart muscle starts to heal soon after a heart attack. This takes about 8 weeks. Just like a skin wound, a scar forms in the damaged area. But the new scar tissue doesn't move the way it should. So your heart can't pump as much after a heart attack. How much that ability to pump is affected depends on the size and location of the scar. These could be signs of a heart attack: discomfort in the chest, especially the center, that lasts more than a few minutes or comes and goes. The discomfort may feel like heaviness, fullness, squeezing, or pain. Discomfort in the upper body parts such as the arms, back, neck, jaw, or stomach. This may feel like pain or general discomfort. Shortness of breath. This may come with or without chest discomfort. Unusual sensations such as cold sweat, nausea, vomiting, lightheadedness, or dizziness. Women are more likely than men to experience these kinds of symptoms. Types of heart attack. Heart attacks can be classified by measurement from an ECG known as the Saint segment. This corresponds to the area of damage inflicted on the heart. Acute coronary syndrome. A heart attack is a form of the acute coronary syndrome, ACS, where there is a significant blockage in the coronary arteries. The 3 main types of ACS include 1. Saint segment elevation myocardial infarction (STEMI), 2. Non-street segment elevation myocardial infarction (NSTEMI), 3. Unstable angina, 4. Saint segment elevation myocardial infarction (STEMI). A STEMI is the most serious type of heart attack where there is a long interruption to the blood supply. This is caused by a total blockage of the coronary artery, which can cause extensive damage to a large area of the heart. A STEMI is what most people think of when they hear the term heart attack. Non-street segment elevation myocardial infarction (NSTEMI). An NSTEMI can be less serious than a STEMI because the supply of blood to the heart may be only partially, rather than completely, blocked. As a result, a smaller section of the heart may be damaged. However, an NSTEMI is still regarded as a serious medical emergency. Without treatment, it can progress to serious heart damage or STEMI. Unstable angina. Unstable angina is the least serious type of ACS. However, like NSTEMI, it is still a medical emergency as it can also progress to serious heart damage or STEMI. In unstable angina, the blood supply to the heart is still seriously restricted, but there is no permanent damage, so the heart muscle is preserved. Other tests can be used to assess the state of your heart and check for related complications. However, because heart attacks are medical emergencies, some of these tests are usually done after your initial treatment has begun and your condition has been stabilized. If doctors suspect you have had a suspected heart attack, a sample of your blood will be taken so it can be tested for these heart proteins known as cardiac markers. The most common protein measurement is called cardiac troponin. Your troponin level will be measured through a series of blood tests done over the course of a few days. This will allow damage to your heart to be assessed, and also help determine how well you are responding to treatment. Chest X-ray. A chest X-ray can be useful if the diagnosis of a heart attack is uncertain and there are other possible causes of your symptoms, such as a pocket of air trapped between the layers of your lungs, pneumothorax. A chest X-ray can also be used to check whether complications have happened because of the heart attack, such as a buildup of fluid inside your lungs, pulmonary edema. Echocardiogram. An echocardiogram is a type of scan that uses sound waves to build a picture of the inside of your heart. This can be useful to identify exactly which areas of the heart have been damaged and how this damage has affected your heart's function. Coronary angiography. Coronary angiography can help determine whether there is a blockage or narrowing in the coronary arteries and if so, to locate the exact place of the blockage or narrowing. The test involves inserting a thin tube catheter into one of the blood vessels in your groin or arm. The catheter is guided into your coronary arteries using X-rays. A special fluid, called a contrast agent, is pumped through the catheter. This fluid can be seen on X-rays, and studying how it flows around and through your heart can help locate the site of any blockage or narrowing. This helps a doctor who specializes in heart conditions, cardiologist, decide the best treatment for you. Heart attack diagnosis. Emergency medical workers will ask you about your symptoms and do some tests. Ideally, your doctor should screen you during regular physical exams for risk factors that can lead to a heart attack. If you're in an emergency setting for symptoms of a heart attack, you'll be asked about your symptoms and have your blood pressure, pulse, and temperature checked. You'll be connected to a heart monitor and have tests to see if you're having a heart attack. Tests to diagnose a heart attack. Your doctor may order tests including EKG. An EKG, also known as an electrocardiogram or ECG, can tell how much your heart muscle has been damaged and where. An ECG measures the electrical activity of your heart. Every time your heart beats, it produces tiny electrical impulses. ECG machine records these signals onto paper, allowing your doctor to see how well your heart is functioning. An ECG is painless and takes about 5 minutes to do. During the test, flat metal discs, electrodes, are attached to your arms, legs, and chest. Wires from the electrodes are connected to the ECG machine, which records the electrical impulses. An ECG is important because it helps confirm the diagnosis of a heart attack. It helps determine what type of heart attack you have had, which will help determine the most effective treatment. It can also monitor your heart rate and rhythm. Blood tests. Different levels of cardiac enzymes in your blood can indicate heart muscle damage. These enzymes are usually inside the cells of your heart. When those cells are injured, their contents, including the enzymes, spill into your bloodstream. By measuring the levels of these enzymes, your doctor can find out the size of the heart attack, and when it started. Tests can also measure troponin levels. Troponins are proteins inside the heart cells that are released when the cells are damaged by the lack of blood supply to your heart. Echocardiography. Echocardiography is a test that uses sound waves to produce live images of your heart. The image is called an echocardiogram. This test allows your doctor to monitor how your heart and its valves are functioning. The images can help them get information about blood clots in the heart chambers. This imaging test can be used during and after a heart attack to learn how your heart is pumping and what areas aren't pumping the way they should. The echo can also tell whether any parts of your heart, valves, septum, etc., have been injured in the heart attack. Cardiac catheterization. Cardiac catheterization is a medical procedure that cardiologists, or heart specialists, use to evaluate heart function and diagnose cardiovascular conditions. The cardiac cath can give an image of the blocked artery and help your doctor decide on a treatment. Thrombolytics. Antiplatelet agents. Other blood-thinning medications. Pain relievers. Nitroglycerin. Beta blockers. ACE inhibitors. What can I do to lower my risk of heart disease? Fortunately, there are many things you can do to reduce your chances of getting heart disease. Control your blood pressure. High blood pressure is a major risk factor for heart disease. It is important to get your blood pressure checked regularly, at least once a year for most adults, and more often if you have high blood pressure. Take steps, including lifestyle changes, to prevent or control high blood pressure. Keep your cholesterol and triglyceride levels under control. High levels of cholesterol can clog your arteries and raise your risk of coronary artery disease and heart attack. Lifestyle changes and medicines, if needed, can lower your cholesterol. Triglycerides are another type of fat in the blood. High levels of triglycerides may also raise the risk of coronary artery disease, especially in women. Stay at a healthy weight. Being overweight or having obesity can increase your risk of heart disease. This is mostly because they are linked to other heart disease risk factors, including high blood cholesterol and triglyceride levels, high blood pressure, and diabetes. Controlling your weight can lower these risks. Eat a healthy diet. Try to limit saturated fats, foods high in sodium, and added sugars. Eat plenty of fresh fruit, vegetables, and whole grains. The DASH diet is an example of an eating plan that can help you to lower your blood pressure and cholesterol, two things that can lower your risk of heart disease. Get regular exercise. Exercise has many benefits, including strengthening your heart and improving your circulation. It can also help you maintain a healthy weight and lower cholesterol and blood pressure. All of these can lower your risk of heart disease. Limit alcohol. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Both of those raise your risk of heart disease. Men should have no more than 2 alcoholic drinks per day, and women should not have more than 1. Don't smoke. Cigarette smoking raises your blood pressure and puts you at high risk for heart attack and stroke. If you do not smoke, do not start. If you do smoke, quitting will lower your risk of heart disease. You can talk with your healthcare provider for help in finding the best way for you to quit. Manage stress. Stress is linked to heart disease in many ways. It can raise your blood pressure. Extreme stress can be a trigger for a heart attack. Also, some common ways of coping with stress, such as overeating, heavy drinking, and smoking, are bad for your heart. Some ways to help manage your stress include exercise, listening to music, focusing on something calm or peaceful, and meditating. Manage diabetes. Having diabetes doubles your risk of diabetic heart disease. That is because, over time, high blood sugar from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. So, it is important to get tested for diabetes, and if you have it, keep it under control. Make sure that you get enough sleep. If you don't get enough sleep, you raise your risk of high blood pressure, obesity, and diabetes. Those 3 things can raise your risk for heart disease. Most adults need 7 to 9 hours of sleep per night. Make sure that you have good sleep habits. If you have frequent sleep problems, contact your healthcare provider. One problem, sleep apnea, causes people to briefly stop breathing many times during sleep. This interferes with your ability to get a good rest and can raise your risk of heart disease. If you think you might have it, ask your doctor about having a sleep study. And if you do have sleep apnea, make sure that you get treatment for it. Now go and get started and live a life that hinders you from getting a heart attack. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle, and other helpful information to form life easier.